Dr. Bedai, lately the medical establishment, by medical I mean, the MDs, well, actually, more close, the surgeons, the guys who do hip replacement, they cut into and take your appendix out, they take your tonsils out, those type of people, surgeons. Over the last few years, not too many years, 2, 3, 4, 5 years, they have more and more started not to do surgery before they didn't send their patient to a dentist to make sure they have no gum disease, no periodontal disease whatsoever. Because if they do, their own surgery, the wound they're cutting might get very infected, fail, and even because the immune system of the body, if it has periodontal disease, it has been only lately become so sure to doctors, is then so low that simply, I mean, how weak can a body be and still cut into it? It doesn't work very well. The body collapses on you, something somewhere. Have you noticed that? Tell us more about it, because if that's true, people should pay more attention to gum disease on an everyday basis also.
Absolutely, Helmut. You summed up a lot of truth in there. Basically, gum and bone disease is nothing more. Periodontal disease is nothing more than an infection of the gum. Perio means around, and dontal means the tooth. So this is an infection that's around the tooth. Guess what's around the tooth? Your gums. So you get a bunch of infection that sits down below the gum line, and that infection is a lot of times known as tartar. Tartar is nothing more than the plaque, that plaquey stuff that sits on your teeth, makes a home below the gum line. And all of a sudden, that stuff gets rock hard. It gets like cement. The bacteria is still there. It feeds off all of the saliva in your mouth. And the byproduct, the waste product, let's tell it like it is. The poop product is acid. That's what it is. And it starts to destroy the gums and the bones of the face. Now, while it's doing that, one of the cardinal signs of inflammation, and we've all seen this, is bleeding. Anytime something that's infected, it will bleed. Why? The body's trying to get a blood supply there to handle it. As it's getting a blood supply there, also, it's getting a blood supply back to all of the other areas of the body. So, if it's picking up some infection that's in the mouth by circulating it and having an easy pathway to go through, well, stop and think about that. That pathway can get to the heart, it can get to the joints, it can get to the lungs, it can even get to the brain. So by having the mouth nice and healthy, you've shut off that pathway or shut down those pathways and removed a lot of extra loads of the brick on your system so that your immune system doesn't have to fight. And we all know that a healthy immune system is something that everybody wants to have.
So basically, the surgeons are definitely onto something by saying no other invasion into the body before this infection isn't cured. Because nobody would do a surgery on a guy who has like a major flu going on and stuff, except if it's a life-threatening bullet shot wound or something. But rather than that, nobody would go and schedule a normal surgery, light or heavy. It wouldn't matter, right?
Well, exactly. Surgeons want to do surgery on the most healthy people possible. It's what they want to do, especially for things like joint replacement, that sort of thing. They want the patients as healthy as they can be because they recover as quickly, or quicker, I should say.
Right.
So, yeah, they want all of the other contributing factors, so to speak, cleared up. And gum and bone disease, periodontal disease, is a most definitive contributing factor to any type of surgery.
Right. And back to my, what I really, what I think we should be, what people should take away from this video in this case is, if this is true, which you confirmed, if a surgeon doesn't want to cut you for a small or a big surgery because you have gum disease, you might want to go and say, whether I have surgery or not, I don't want to have gum disease, because the reason the guy doesn't want to cut is because it weakens your body, and you don't want to have one part, you don't want to have some parasite on your body nagging away from you, which is what every infection is. It's a parasite. It eats away from you. Like, for instance, there's lots of people out there, just a short comment, we don't have much time anymore, lots of doctors out there who say, okay, cholesterol level, and we all know good and bad and high cholesterol. And really, lots of doctors now also keep saying, it's not so much the amount, even of the good or bad, but does your body have infections in the body, your blood? Does it have infections? Because if it has it, that's how the cholesterol goes to it. It has to go through the infection, it binds, and it becomes all of a sudden that gluey stuff, which otherwise actually it really doesn't if the body would be free of infections.
Yes, absolutely. Cholesterol is not a bad thing. Cholesterol is a good thing. It's a waxy substance that keeps the integrity of your body. So you need it there. It's there for a reason. And once again, any part of the body that has an infection in it that's not supposed to be there, and I don't know any parts of the where infection is supposed to be there, but get the idea that if part of the body has infection in it, you want that cleared up. You're just helping your entire, health scene with it.
Especially if the infection is at the gateway of your blood vessels, so it drips into your blood very easy, goes all over, as you said, kidney, liver, everywhere, diabetes gets linked, and it gets nicely mixed up with the food and gets then put in the stomach and travels from there too, goes everywhere, lungs. So now you have it's like the perfect multi-level system. It's like the perfect viral marketing, you can possibly get. You want to spread any message, go and see how the body spreads an infection and duplicate it in the real world, and
there you go. That's like the perfect storm.
Yes. Well, Dr. Bede, nice talking to you as always. Bye-bye.
Okay, Albert.